as well as verbal and nonverbal skills, compared to those who do not end up developing autism. And there's an emerging consensus in the field that these symptoms are beginning to emerge between 6 and 9 months, further to intensified in the second year of life. And that's possibly just so. Maybe this is just a natural course of autism, that we will not be able to see anything absolutely any strong indices of autism at 6 months. But it is also possible, being skeptical as we always are, it is also possible that the methods we are using, the instruments we are using, are not sensitive enough to detect more subtle abnormalities which are related to pathogenic factors associated with autism. And I'm going to come back to this point in a little while when I give you a little bit of a case study later on. So by 12 months, again, emerging consensus is that by 12 months we might begin to see some differentiation between children who end up being diagnosed with autism and those who don't. Some of the important areas of impairment, this unfortunately doesn't work on this either, is the fact that children with autism show quite limited response to name. And this is not because they don't understand language or they have impaired hearing. There's something about the there's something about the name. It's not a regular word. It actually represents a very complex concept, which is a concept of self. And children with autism have tremendous difficulties responding when their name is called. There are reports of limited eye contact, limited use of communicative gestures, some delays in language, and also emergence of atypical, the third group of symptoms in autism, emerges of atypical way of exploring objects. Our colleagues from the Mind Institute reported recently a study in which they say that children who later are diagnosed with autism tend to play with objects in more atypical ways, spinning them more often than other kids, and also examining them visually in a more prolonged and intense manner than other children. But the first year of life still remains a frontier for us when we are still very actively studying both the symptoms and the underlying mechanism. From the clinical standpoint, we are much better informed with regard to symptoms of autism in the second and third year of life. A lot of work have happened in the past 3 years to contribute to that success. When Fred mentioned that in the 1980s seeing a 4-year-old was very unusual in a clinic, when we started a toddler clinic in the year 2000, we were primarily seeing referrals of children who were 3 or 3.5. Seeing a 2.5-year-old was very, very early, very, very unusual. Right now, I would say the most frequently, the age of referral is around 18 to 20 months, which has dropped quite significantly in the past 10 years. I'm going to go quickly through some of the most well-known and studied symptoms of autism in the 3 key areas. Normally I would show you some videos. We are trying to limit the number of videos which contain privileged information in this particular presentation. So I'm going to describe them to you and then show you one single case study a little later. I think one of the most striking things that happen when you walk into the waiting room when there are parents and a toddler waiting to be evaluated is how little your entry matters to this child. It takes a lot to attract the child's attention, to make them notice that you actually enter the room, and let alone to respond to a greeting. Children at this age are very interested in exploring their environment. We see a lot of climbing, a lot of exploring toys, touching them, moving. They often like toys which create immediate effects. We call them cause and effect toys, when they push a button and something happens, and they can get engaged in this activity for a prolonged period of time. to the extent that interactions or an attempt to regain their attention can be quite unsuccessful. When we try to engage a child in a reciprocal interaction, it's usually quite hard, quite difficult. Children might actually enjoy greatly playing with an examiner when we show them some interesting toy. They might enjoy the toy very much, they might smile at the toy, they might stay with the toy for a long time, but there's no sense of shared activity. There's very little sense of shared activity and shared enjoyment. Our toddlers often make eye contact quite often. However, the quality of the eye contact is rather atypical. It doesn't usually occur when you expect it the most, and occurs sometimes when you don't expect it at all. It's often very fleeting, and it's not very well meshed with communicative bids and attempts to engage